over 100 years, the American Lung Association has been working to save lives by improving lung health, from tuberculosis prevention to tobacco awareness, and their staunch support for the Clean Air Act. The ALA has been helping educate the public. When we read the report this spring about air quality in our region, we had to go straight to the source. So it is my pleasure to welcome Kevin Stewart. Kevin is the Director of Environmental Health, Advocacy, and Public Policy for the American Lung Association. I think he's going to be able to tell us why Camden and Gloucester received some bad grades and where's Burlington County. So Kevin, I think you should be able to share your screen. Good. Kevin, are you there?
Yeah, hello, I'm here. I'm just making sure it's, there we go. Good, thanks. Okay. Thanks very much, Deb. I appreciate the introduction. And following Sharon's talk, which was just awesome, some of those questions are already answered if folks were paying attention. And I think this group is a very attentive group. So, you know, certainly the Lung Association does have, you know, our long history, you know, as the leading national organization. You know, we're going to work on save lives by improving lung health and preventing lung disease through research, education, and advocacy. And we have 4 strategic imperatives: certainly defeating lung cancer, creating a tobacco-free future, championing clean air for all, and that's both outdoors and indoors, and improving the quality of life for those with lung disease and for their families. And people can get information about us at lung.org or 1-800-LUNG-USA. This is a little outline, certainly a description of the State of the Air report looking at New Jersey's air quality in particular, populations at risk in the TCS area, calls to action, and just reminding folks about more information is available on the report at lung.org/SOTA. And the State of the Air report, it certainly puts air pollution information into everyday language. The idea is to provide some local information to people and to focus people's attention on the 2 major national air pollutants, ozone and fine particle pollution. The you know, the reasons for why we want to tell people about air quality. So we certainly want to help people protect themselves from air pollution. There are millions of people out there who face high risk of harm. We're giving people ways to advocate for healthy air. There are a number of opportunities that are presented. And we want to encourage people to support programs that cut pollution and improve air quality. And this is through the kind of awareness that people can have as a result of understanding more about the quality of the air that they're breathing and what their options are. Of course, last week, this is you know, certainly what Sharon was about, you know, with the slug of wildfire smoke into you know, this area, and certainly then shortly thereafter into New England. This is the kind of air pollution that sort of is in people's minds. At the same time, the State of the Air report is something that is using accumulated data. So for instance, for the 2021 report, there's air pollution data that was from 2017 through 2019. Once that data have been quality assured and validated, EPA then posts the data online. We have a consultant who downloads that data, which finally became available to us roughly about this time last year from those 3 years. We do some analysis of it, calculate grades, rankings, and so on. And the basic idea here is that you know, our grading does use the same data, of course, to determine that, as for instance, DEP uses to calculate non-attainment. But the grading method, the analysis method, is not the same as EPA's. It's not using the same methodology to determine whether an area is in attainment or not, even though that's an important legal structure that's necessary to help states know what's going on, what industry needs to do, and so on. We also recognize that even one bad air day can be one bad air day too many for someone in one of the sensitive risk groups. And so we will then look at the number of days. So for instance, for ozone with a high 8-hour average, particle pollution, where there's 24-hour averages that exceed the standard, those exceedances, as Sharon talked about, that are being counted. And we also look at the year-round annual average, as well, the design value for that. And only counties with monitors get graded. And as you saw, there was no dot in Burlington County on Sharon's map. And that's why there's no grades for Burlington County. We grade only the air quality, not the effort to clean it up. If everyone at DEP works as hard as I heard in this last demonstration, just 10 minutes ago, the effort would clearly be very, very strong. So I want to emphasize that. But we are grading the air quality. We tell people the truth about that. This is our 20-second look at it. We give A through F grades, pass, fail grades to about 900 counties around the country. Only a third of the counties have monitors that have data that we can grade. And we rank metro areas. So there's this worst 25 cities list. We call them cities, but it is these the largest metro areas that describe an area. And so, for instance, get to the data. Here's what air pollution looks like for the daily measure of fine particle pollution. Most counties that have monitors are getting A grades. That means there was no bad air day according to the current EPA standard, which the Lung Association, by the way, recognizes as too weak to adequately protect public health. But at the same time, we'll use that standard, giving A grades to all those counties. However, Camden County is the worst in the state with the C grade. And that gives you some idea that there is still an issue here, even with a weak standard. This is the annual stuff. And then here, in this case, Cumberland and Gloucester counties both had incomplete data, and I don't know the details. Sharon might be able to clarify, exactly what happened there for 2017 through 2019. But we couldn't give a grade for Gloucester County, even though there is PM monitoring there. And this is ozone. And New Jersey, of course, has struggled with ozone. Lots of counties are getting F grades, Camden and Gloucester both. And that's something that gives you an idea here. Here's a summary. We look at what we call a weighted average. If an area has orange air quality day, we'll tally it as 1. If it's a red day, it's 1.5. If it's a purple day, we'll give it, a 2 weighting. And this gives you an idea that over the 2017-2019 period, Camden County had on the average, 6.7 bad air days a year for ozone using that method of calculation. Once again, it may not sound like much compared to 365, but at the same time, ozone, for instance, we do recognize that the ozone standard also is weaker than we'd like it to be. So there would be normally a lot more days counted if we actually had a stronger standard. And then in addition, we recognize that even one bad air day can be bad for people. Bad air days often occur episodically, so sometimes there's sequential problems, one day following another. That also adds to the health risk. So here you go. The long-term average here, 10.2 micrograms per cubic meter for the long-term average fine particle level. Even though that's well below the 12 microgram standard, it is above the 8 microgram standard that the American Lung Association advocates the standard should be. Of course, we also report metro ranks in South Jersey as part of the Philadelphia, Reading, Camden combined statistical area shown on the map. And that ranked, when we compare with around 200 metro areas around the country, 2 of those rankings ended up on the worst 25 lists, 21st worst for ozone, 17th worst for annual. And we also know that, sometimes Camden County has actually been the worst county in this metro area. This year, for instance, Philadelphia County leads with the worst ozone, but it does give you some idea of the situation here, that we do still struggle and don't rank very well compared to the rest of the country, at least when you look at the thing in a broad metro area way. Why do we tell people about air quality? Well, nearly everybody has someone in their family who has is in some kind of high risk group. Certainly people of color facing increased risk. We also know people with low incomes, they'll typically live closer to sources, may have higher incidence of disease, less access to care. Children, teens, elderly people face higher risk. And then also those with underlying health conditions, people with asthma, heart disease, diabetes, lung cancer, all those put people at higher risk from air pollution. And then there's some other groups, of course, people with smoking history are at increased risk, and a person with smoking history doesn't have to be very many cigarettes before we start to count them in that group. But we do know that statistically, independent of their problems with smoking, when they're exposed to air pollution, they're getting a higher risk. And then, of course, people who work outdoors, exercise heavily. We advised people recently with the recent air pollution event for people in high risk groups to stay indoor, but also even healthy people can have some consequences when they're exposed and are exercising and doing strenuous work outdoors. This gives you a ballpark idea of the people at increased risk in the Tri-County area. And you can see that we're talking about, in different categories, tens of thousands, sometimes hundreds of thousands of people fit into those categories. Now, it doesn't mean that everybody in those categories is going to experience a problem on a high air pollution day, but it does put them at higher risk. It weights the dice that might lead them to have an asthma attack or go to their doctor or emergency room, or in some cases, die prematurely because of a heart attack or a stroke or a respiratory episode. So this gives you some idea of the populations at risk. And we also have advocacy priorities here. I mean, certainly our main message of this year's report was that too many people are breathing unhealthy air, and they're disproportionately likely to be people of color. And we have been calling on President Biden to promote environmental justice by prioritizing the historically burdened communities for pollution cleanup and to receive the benefits of investment that a transition to electric vehicles, clean renewable electricity would bring. We want to make sure that that is addressed. And there are 3 sections in our State of the Air report. In one section called, in one chapter called Protect Yourself and Your Community, we certainly have a piece called How to Reduce Your Personal Risk. There's tips there on how to protect yourself on unhealthy days. And we saw there's lots of great resources in New Jersey already that Sharon clearly displayed. Improve the air in your community. Certainly the emphasis on driving less, consider EVs, conserving energy, don't burning wood or trash. So these are common sense, but nevertheless, they're important. Advocate for cleaner buses and get involved. It takes engagement to do these things. And then certainly we do have something called Stand Up for Clean Air initiative at lung.org/air. And then we also have a section on clean air policies where we're talking about threats and opportunities. And at the national level, there's some key actions that we want the federal government to take. And certainly we lay those out, whether it's the president investing in climate action and benefiting underserved communities, or Congress doing things to the COVID recovery legislation, invest in state, local, tribal air quality and monitoring, because if you don't know about the air quality, it's hard to fix it. EPA, several things. We want stronger national limits on ozone and particle pollution that really do reflect the science, unlike the current standards. And we want to limit methane. Certainly, there's that. Clean up wood heaters. And we want this to be something integrating climate health across the entire federal government is something that makes sense for, like, for instance, the Department of Health and Human Services to lead. And up here, why do we publish a State of the Air? There are millions of reasons.